Ones frequently worry about breast cancer, especially older ones. Younger women who have had breast cancer treatment, however, could have particular queries and worries about their fertility and the security of conception. This video attempts to explain you on the different facets of breast cancer and its potential effects on pregnancy and fertility. Concerns about fertility following breast cancer treatment. The impact of treatment on young breast cancer survivors' fertility is one of their top worries. While many women who have had breast cancer treatment can still become pregnant, several therapies can make it more difficult. Depending on the length and intensity of the treatment, such as chemotherapy or radiation, the ovaries may be affected, leading to a decrease in egg production or reproductive system damage. Before beginning breast cancer treatment, women must be honest and forthright with their healthcare providers about their options for preserving their fertility. Egg or embryo freezing may be used in this, giving these women the chance to pursue conception after their treatment has been effective. Breast cancer and breastfeeding. Many breast cancer survivors are interested in the topic of breastfeeding because it has been linked to a lower chance of getting the disease. Breastfeeding following breast cancer therapy may lower the likelihood of a recurrence, according to research. To completely comprehend the scope of this benefit, additional research is required as the information on this particular component is sparse. Despite the advantages, some breast cancer survivors could experience difficulties when trying to nurse from the afflicted breast. Changes in structure and decreased milk production may affect a mother's ability to breastfeed. Additionally, some medications taken for treatment may enter breast milk and have an impact on the unborn child. In order to avoid complications, survivors must speak with their doctors before attempting to breastfeed. Pregnancy timing following breast cancer treatment. Breast cancer sufferers must wait for their bodies to fully recover before trying to get pregnant. After completing breast cancer treatment, experts advise waiting at least 2 years before attempting conception. This waiting period gives the body time to recover, lowers the probability of a cancer recurrence, and improves the likelihood of a healthy pregnancy. Moreover, it is crucial to finish this program before trying to get pregnant for survivors who are prescribed adjuvant hormone therapy, which commonly lasts 5 to 10 years after initial treatment. If necessary, hormone medication can be restarted after childbirth. Possible obstetric complications. Breast cancer history may raise the chance of some pregnancy issues, including preterm delivery, low birth weight babies, and the requirement for a cesarean surgery. The health of a woman's unborn child, however, has not been directly linked to her history of breast cancer, according to study. Breast cancer survivors who are pregnant are urged to follow up with their doctors frequently so that their and their unborn child's health can be constantly monitored. Stopping pregnancy treatment. Women may occasionally feel pressured to forego receiving breast cancer treatment altogether in order to become pregnant. This choice has a very high risk because early treatment termination raises the possibility of cancer development or recurrence. To ensure that the right treatment plans are in place and to investigate possibilities for fertility preservation, It is crucial to discuss family planning goals with healthcare providers as early as possible. Despite being frequently linked to older women, breast cancer can also affect younger women, posing questions about fertility, pregnancy, and lactation. Despite the fact that many women who have breast cancer can still conceive and deliver healthy babies following treatment, some procedures may compromise fertility, thus special care should be given. It may be advantageous to continue breastfeeding following treatment, but it is important to take into account each unique situation and consult a doctor before making any decisions. It's important to act quickly, therefore breast cancer survivors are advised to finish any prescription hormone therapy and wait at least 2 years after treatment before attempting conception. To achieve the greatest outcomes for the mother and the child, the road to parenthood after breast